Hello everyone, my name is Jessica Barnett. For my evidence-based project proposal, I explored the topic of depression in adolescents. The title of my proposal is The Effects of Cognitive Behavioral Therapy on Depression Symptoms in Adolescents in Primary Care. Here is the poster I put together. I'm going to break down each topic in the following slides. So first I'm going to talk about the healthcare problem I selected to review. Approximately 3 million or 12.5% of children from the ages of 12 to 17 had an episode of major depression in the year 2015. Of those affected, only half are diagnosed and even less receive treatment. This is a major concern since untreated depression can lead to suicide, which is the third most likely cause of death in adolescents. The target audience for this project includes individuals that provide primary care. This is an important topic for family nurse practitioners as they have the unique opportunity to assess and screen adolescents. There is a Healthy People 2020 objective to have increased depression screenings of adolescents in the primary care setting. The target population for the intervention is adolescents from the age of 12 to 17. They will be screened for depression during clinic visits at Family Practice Associates, a primary care clinic in Lexington, Kentucky. And cognitive behavioral therapy is the proposed evidence-based intervention for the target population. 4 studies, both randomized and non-randomized controlled trials, demonstrated that CBT reduced depressive symptoms in this age group. On the next slide, I've listed the objectives for this project. First of all, the goal is to identify adolescents at risk for depression in the primary care setting. The overarching goal is to reduce depressive symptoms and prevent relapse in adolescents. Additionally, I aim to determine the effectiveness of CBT on depressive symptoms in the primary care setting and learn about the use of CBT by family nurse practitioners. Lastly, an objective is to improve access to mental health care. So on the next slide, I will talk about methods for the intervention. First, all the adolescents are screened during clinic visits, whether sick or well visits. The Patient Health Questionnaire 9 will be used to determine depression symptoms. Adolescents that score at least 10 will be contacted for eligibility. After receiving consent, the adolescent will have their initial session. They will be interviewed using the Child Depression Rating Scale Revised to determine depression symptoms. Next, they will have a 30-minute CBT session with a trained family nurse practitioner. During these sessions, the adolescent and FNP will discuss goals for therapy, breaking each goal down into achievable steps. Barriers and facilitators will be discussed. After the session, 15 minutes will be spent with the parent discussing concerns, updates, and homework involving parents. The adolescent will schedule 10 30-minute monthly sessions. After each session, the FNP will check in with parents. And during the last session, the CDRSR will be repeated to reassess depression symptoms. The results are discussed with the adolescent and parent. The session is focused on preventing future relapse of depression. If the adolescent's depression symptoms remain high, then other options will be discussed, including pharmacotherapy, continued CBT sessions, or referral to a mental health provider. On the next slide, I'm going to talk about the instruments that we will use for screening and assessing depression. So the PHQ-9 is frequently used instrument to screen for depression. Adolescents that score at least 10 will be considered for inclusion. The PHQ-9 consists of 9 questions and has a 4-point scale. It takes no more than 5 minutes to administer, and in adolescents, it's got a very high sensitivity and specificity. Next, the CDRSR will be used twice during the intervention, at the initial session and the last session. This is a commonly used tool to measure depressive symptoms in children. It contains a 17-item interview with questions ranging from 1 to 5 or 1 to 7. A score greater or equal to 40 is indicative of depression. For adolescents aged 12 to 18, Cronbach's alphas range from 0.79 to 0.92. All right, on the next slide, I'm going to discuss some implications to nursing practice. So there are several implications of this intervention to advance nursing practice. The literature demonstrates how important it is to engage youth and their parents in treatment for depression. Additionally, focusing on early intervention and screening may reduce the costs of depression. The proposed intervention begins with screening all adolescents during primary care visits. Due to the prevalence of depression in this age group, a 5-minute questionnaire is an efficient way to identify youth at risk. The literature has shown that CBT is an effective intervention in treating depression, including in this age group, and training FNPs to provide CBT would help fill the gap in available mental health services. In many communities, there is a lack of providers and availability, and this intervention would provide useful information about the utilization of CBT by FNPs. And most importantly, patient outcomes, especially depressive symptoms, would improve by implementing this project in the practice setting. On the next slide, I've got my references here. I hope that I provided some valuable information about depression in adolescents and illustrated the importance of screening and treating individuals in primary care. And if you have any questions, please let me know. Thank you for your time.